So I have the pleasure of introducing myself, being the moderator and also the next speaker. First of all, I want to take a couple of minutes to thank Zev and Milton for thinking of this as such a novel idea in our field. I was just thinking to myself as I was listening to the lectures, I have not been to a course in the last 25 years where I've learned so much and only half the courses completed. Just a bunch of new ideas, and it's been very refreshing for me personally. So thank you for that. I'll also just briefly introduce myself. My name is Michael Alper. I'm a physician, a fertility specialist. I originally did my training in Canada and moved to the United States in the early 1980s to start an IVF program called Boston IVF. We started in 1986, and like many of you in the room, started from a very small practice. And then what happened with time, I guess through a lot of hard work and good luck, I suspect also, we've grown to be a prominent program in the United States. We're situated in Boston, which is in the northeast part of the United States. We have one main facility, but we also have other IVF facilities in New England. We've grown from a few cycles to about 3,000 cycles. We have a staff of about 250 people scattered in different offices. And it's been a real learning experience for me over the years to start from basically a doctor's office into, I'll call it a mini hospital, and how to manage all the different parts of it to provide continued the best care we can. So I would like to just use the next 25 minutes or so just talking about very practical issues. Just as a physician, what we've been able to use in our clinic to maximize the internet. And so I'd like to review just some of the practical and clinical considerations, just everyday tools. I'll call them helpful tips. So I'm going to just go through a few helpful tips that many of you may already do, but maybe some of you can adopt in your own clinics. And I'll call them helpful tips. The first thing I'd like to talk about is documentation. We have a lot of papers in our IVF centers. In fact, before we became ISO certified, I asked everybody in our organization to collect every piece of paper that had the name Boston IVF on it. And to my surprise, we had 3,000 documents in our IVF center with our name on it, including outdated consent forms, outdated materials, things that I thought were never there, that were there. So that's a separate discussion, how to control those documents. But I think that the Internet is a terrific way of making these documents available to your patients. So for us, we have on our website, you put in a password, a username and a password, and that allows you access to virtually every document that we have that's related to patient care. And the huge advantage of that is that we don't print any materials anymore. The patients can go to the website, look up a document, print a consent form. So when I see a patient and I say, oh, we're going to be doing IVF, I say, okay, here's a username, password, go to our website, download these 3 documents, print them out, and when I see you for the pre-IVF consultation, bring them with you, and we'll sign them together. So we don't have to print them out. The patients have time to review them at home when they're comfortable, and so on. So it saves money, and it also assures that patients are getting the most current document, and they can also look at it on all their mobile devices. So this is just some examples of the patients put in their username and password, and they can see all our documents. So these are consent forms. If they were to click on here, there'd be a consent form for IVF, consent form for embryo freezing, embryo thawing, and so on. Also, papers on how to do the injections, how to mix medications. Also, timelines and calendars are all available to patients with a username and password. We also have lots of other documents that they can have access to. Authorization forms, information about insurance, anything that you would normally hand to a patient, you should have on your website or on a secure place where you can make them available. And these are just some examples. So we have a document, the Guide to Embryo Grading. I mean, there's many different grading systems for embryos. Every center has a specific one that they use. There's a lot of questions about embryos when patients come for the embryo transfer. So we ask them to print this out before they come, so it makes the conversation a little bit more intelligent. But virtually any document can be placed on the website. I also want to talk about the initial appointment, and I'm going to describe how we do our initial appointments at Boston IVF. So this is the way it works. They hear of us either through the internet, a friend, or so on. They call, they speak to my secretary. When she's on the phone with them, she enters their demographic information, date of birth, address. They always ask, how'd you hear about Boston IVF? Who referred you to Boston IVF? That's all information that we take in the initial phone call for data analysis later. And then we send a letter to the patient, and it gives them the username and password to our patient portal so they can access information. We use a program called IVF, which is the company is called Practice Highway, and Jawid, who's the CEO of that company, is available if you have any questions about it. And it's an interesting marriage because about almost 10 years ago, we had a no electronic system. There are still not many to choose from. Many people develop their own or use some of the commercially available systems. So we developed this program called IVF. We have no commercial interest in IVF. We just helped develop it, and maybe we got a little discount on the price. But it's a program that's used in about 50 clinics in the United States at this time, probably the most popular program. So this is an example. This is the patient, once they get the letter with the date and time of the appointment, the address, and so on, they log into a patient portal with their username and password that was given to them in the letter. They log on, they put in their basic demographic information, just fill it in themselves, as illustrated here. Later, when they arrive at the clinic, we can also take a picture and put in as part of their medical record as well. And this is what the patients see. They see different categories or little chapters of information where they enter their own information themselves. Past pregnancies, medical history, gynecological history, genetic and family history, and so on. It's all done in pretty standard format with a lot of pull-down menus. And the beauty of this is they're doing it at home when they're relaxed, they have the time. They're not doing it in your office where they're trying to fill out these forms very quickly. And there's certainly an advantage to that. So this is just some examples of the screens that are used to enter the female information. They also enter the tests that they have. And most of them are pretty accurate. They may not know the exact level of the AMH that they have, but they will know if it's normal or abnormal, or they'll say they don't know the result. But it gives you a very good overview of their testing. Another example, just the infertility test, as I mentioned. And this is important, genetic history. Many of us in the room who practice infertility are also part-time geneticists, because for the first time, we have the ability to ask patients and screen patients for genetic conditions. And unfortunately, what happens in the real world is when somebody's pregnant, they see their obstetrician, they do a cystic fibrosis test, and they find out they're a carrier, test the husband, he's carrying, they find out the kid has a 1 in 4 chance of having a serious illness, when this could have been prevented if they had cystic fibrosis testing when they saw the infertility specialist before they got pregnant. So genetic history is very important. Now what happens is once all this information is entered by the patient, it's impossible to read this, so don't worry about reading it. All of it is put into a summary form. And what I do is before the patient walks in the door to see me, I go into the computer, I look up the information on the patient, and before the patient walks in the door, I know 95% of what I need to know about that patient. So, instead of me being a secretary and typing in everything as she's talking, before they walk in the door, I write my note. I write my note because I have a template. I have a template called the initial infertility consultation. It's a lot of blanks in it, but I put my progress note in. And it only takes 3, 4, 5 minutes because I know all the information that the patient gave me on the portal. And also, if you've been doing this for long enough, within a few minutes, you know exactly what you're going to say and recommend before the patient walks in the door. And then you use what the patient says to modify your thinking. But that's how we do the initial consultation. So in order to not be a secretary when the patients are coming in and typing like this, most of it's entered before the patient walks in the door. Another thing I want to talk about is communicating IVF instructions, how we do it. In our system, we can release the flow sheet, release the information about the IVF cycle to the patient. So we make a decision, take FSH 225 units for 2 days, come back for another ultrasound. We can release that information to the patient. And then the patient logs on to the patient portal and has access to all of her cycles, all of her IVF cycles, all of her, this was intrauterine insemination cycles over time. And they can click on a cycle and find the results. So here's an example. This is the flow sheet. This is what the patient sees. And she can see, like if she logged on this day, she'll say, oh, the doctor, these are results of my estrogen level, my follicles, and so on. And we have the option of speaking to the patient and giving the information, or if maybe somehow we can't find the patient or we get voicemail, whatever, the patient has access to the information. It's not to eliminate the communication, but it's to give a secure backup if the patient has no further questions. They just want to know what to do next. In addition to the cycle information, the patient could also look up every blood test, every test they've had at our facility. I think the theme of what the lectures that you've heard so far is that medicine is becoming more and more transparent. What I know, the patient should know. There shouldn't be any notes, cryptic notes in your chart about the patient that you don't want the patient to see herself. So it changes the way we think a little bit in our field, that everything that's in the record you have to realize is ultimately the patient's property. I want to talk also a few minutes about IVF teaching, how we do it. And again, this is our own personal way we do it at Boston IVF. There's other ways to do it. The problem with classes, and most IVF programs, what they do is they have these classes where 2 or 3 couples will get together or more, and they'll teach them how to do the injections. I think that's the way the majority of us have done it in the past, at least in my experience. The problem with this is it's very inconvenient. One or both of them have to take time off of work to come for teaching or go in the evenings. Still inconvenient. So it could be a little embarrassing. They're there with a group of other people they don't know, talking about something that's pretty sensitive. So it's a little concerning that way. And it's expensive when you think of all the time that nurses spend going over the same thing. And it's monotonous. The nurses are teaching how to do injections over and over again, and it could be pretty boring for them. So we changed the way we do it. And so the traditional way is, the couples are asked to make an appointment for injection teaching, and several couples come for the class. The way we do it is we give written instructions, which are also available on our web, on how to do the orientation and how to learn about the injections. And the instructions are done with video. Now, most of these videos are available on many sites which you can ask your patients to go to. If they want to go to a pharmaceutical company's website and click on how to inject or mix and inject that particular medication, the information's there. So if you can recommend go to the ABC pharma company and look at their website if you don't want to develop the videos yourself. So the way we do it in simple terms is we have a treatment guide. We give a written material. Here's the information you need to know about IVF, so it's all written down for reference. And all the materials are also available on our website in written form. So information about how to administer the medication with diagrams and so on. And this is an example. These videos are available to the public in terms of how to give injections. And the patients can watch them over and over again, and so on and so forth. So I think all the teaching could be done over the internet and with good reference material and diagrams. This is just one example of how it could be done. So what we've done is with this little checklist that we have, we ask the patients to do 5 or 6 different things. Then our nurse calls them on the phone and says, okay, I just want to review what you've done, what you understand, what you don't understand, what you feel comfortable with. So the orientation is done by telephone, not face-to-face. And we found that about 85% of our patients will be using the telephone discussion with our nurse rather than coming in for a face-to-face. And the ones that come in for the face-to-face are usually ones with a language barrier, or they just need more time to explain things. So we're certainly open to that. It's never going to be 100%. One of the concerns we had was, are patients going to be happy with this? Do they want this face-to-face, or would they prefer to do it on their own schedule? And we found that the vast majority of our patients are happier doing it online than coming in to see us. Michael talked about email. It's a bit of a complicated story. It's tempting. It's easy. It's instant. And it's very convenient and, of course, no cost. Avoids telephone and voicemails. One of the biggest concerns that I have in our organization, which we talk about a lot, is voicemails. It's frustrating for patients and needs to, people want to speak to us live, and certainly email provides an instant way of communicating. And it's also great for patients who come from outside your area to communicate with you. But here, the main problem is that email is not a secure website and a secure method to communicate, and for many reasons. And one of the risks that happens, as I know many of you have probably experienced, you can end up having a chat with the patient, goes back and forth about communicating, and it's not effective. So you have to know when to say, okay, enough, you have to come in and see me. The biggest problem that we face, at least in the United States, is there's very strict regulations about privacy, patient privacy, and email without a secure framework is against those guidelines. So there has to be a framework for which to do that. So there are different choices. Maybe we can get into it later in terms of encryption, user passwords, develop guidelines, as Michael mentioned in the previous lecture, about how you're going to use email. We don't use name. If we send an email, we don't use a name of a patient. We use an ID number and initials. If I send an email to another person in the company, just in case that email would get out of our network. I want to talk about e-prescribing, another very simple thing. Many of us are accustomed to writing prescriptions. I can't remember the last time I wrote a prescription because it's all done electronically. And there's definite advantages of doing this. As doctors, we don't have very good handwriting. So if it's typed up and it's neat and legible, that's a safety issue. And also, a prescription could be sent electronically or by fax to the pharmacy. So I think it does improve safety, it reduces time, and it avoids the issue of wrong dosages and so on being interpreted by the pharmacist. So the very simple thing is what we do is, and I'll show you an example of this, is we write the prescription in the computer, it goes through our medical record and goes to the pharmacist, and the patient picks it up. It's a little more complicated than this in the United States, and I'm not going to make it more complicated than you need to know, but there's actually, in the United States, there's an intermediary. The prescription goes to a central service that has input from the insurance companies and so on and so forth before it actually goes to the pharmacy. And there's software, different programs available to do this, multiple different programs that have been available. This is just the example in the States. I won't go through this. But here's what's interesting. In the United States, the government is proposing to pay you a little bit more if you do electronic prescribing because they realize that it's more efficient and reduces error. So at least in the United States, when government will adjust what you get paid for procedures based on whether you use an electronic system or not. This is the way we do it at Boston IVF. Every medication we use is in a menu like this. We just click on the menu, shows up, and we just fill in the dose. It takes 30 seconds. And we can choose which pharmacy to send it to, depending on what the patient wants. And we click a button, or we can do like this. We can print it out. And this could be automatically faxed to the pharmacist, or we can give it to the patient to bring it. Just a neat way of prescribing medications. Simple. Just a couple final points. I'll call this public education, and one of the previous speakers, I'm not sure it was Jonathan or one of the other speakers, talked about chats. We have one of our doctors will take an hour of his time, maybe once every other week or something like that, and be available to answer questions. It's not a live chat like a video chat, but in terms of electronic questions and responses. And it's worked well because it's just a way of educating the public, answering questions, and ultimately it will attract patients to your IVF center if they perceive it as being an educational tool and professional. A couple final points. I just want to talk about remote access to your data. Many of you are familiar with remote desktop or something called JUMP. JUMP is what I use on my phone or my iPad, and it allows me to get remote access to my computer or our server in the office. So I can look up anything, anytime, from anywhere on any patient of mine. If my nurse called me right now and said, I want to talk to you about Mrs. Jones, I want to go over her last ultrasound, I pull out my iPad, I go to JUMP or remote desktop, I get on my computer, I can see the whole medical record. So it allows a lot of flexibility if you can access your information from anywhere that you are, especially when you travel. Just some examples of it. So remote access to your data is important because we're not in the office all the time. And this is just an example where I can log on to our server using, this is my iPad here, and get information, which I did yesterday on some patients. And whatever system you use, it's going to be on your server so you can get access to it. So in summary, internet is obviously a very important tool to allow patients to access their information. I think we're going to become more and more transparent as time goes on, because as I was alluded to in yesterday's talks, is that the patient, this is what Jan was saying yesterday, the patient really owns their information. It's their data. It's not the doctor's chart. It's their chart. It's their information. And it's going to be more and more transparent, as I mentioned. We use it to enter new patient information, so when a patient walks in the door to see me, before I even see them for the first time, I know 90% of their story. I think that's an advantage. We use the internet to teach patients how to how to administer the medications, because if you think about it for a second, when patients come to see us, they are totally overwhelmed by the information that we're giving them, and it's very, very difficult to absorb it. We're making them into mini nurses by learning how to give injections and all kinds of crazy stuff that is a lot to assimilate. So if they can do it at home at their own pace, write down their questions, it's much better. And of course, as I mentioned, to access documents in your center is important. And I think it's important, since we're all very mobile society right now, we're not in our office all the time. You have to have a method to access patient information when you're away from your office. I think that's important. And we use it for other tools like prescribing medications and so on. And we didn't get into it, but email is a way of communicating as long as it's controlled, you have guidelines, and you follow all rules within or regulations within your country. So thank you. If you have any.